Welcome back to Dr. Netherliska. Being a psychologist, I have helped many men and women overcome their mental challenges through therapy and rehab. Today's segment will focus on the daily struggles of dealing with type 2 diabetes. A majority of people believe type 2 diabetes is a problem occurring only physically, although diabetics suffer mentally and emotionally as well. Today, we'll be meeting the Johnson family to discuss their struggles ever since Mitchell was diagnosed 10 years ago with type 2 diabetes. As a psychologist, my job is to help him and his family find strategies to cope with this illness. Unlike type 1, where the pancreas is unable to produce insulin, type 2 diabetes specifically is defined as the type in which the beta cells of the pancreas produce insulin, but the cell receptors are resistant to bringing in that insulin. The aim of treatment is trying to lower blood sugar levels by tracking the macromolecule intake. Fortunately, Mitchell's wife, Emily, is a dietitian, and she is here to inform us on the proper diet, and especially the quantities of each macromolecules for a diabetic specifically. And his daughter, Petunia, is also here. She's a podiatrist, and she's here to inform us on how the physical damage of not adhering to diabetic regime can affect one. Now, here's a video to describe exactly how glucose has trouble entering the cells in the diabetic and how a person with diabetes receives glucose easily.
Thank you so much for having us on your show. I'm Emily, and this is my husband, Mitchell, and this is our adopted British daughter, Petunia, who just recently graduated with a major in podiatry.
Nice to meet you all. Now tell me, how has your diagnosis affected your health and more specifically your family life, Mitchell?
Hello, thanks for having me. I am a school bus driver. I have type 2 diabetes. I am always hungry, so I eat a lot, and I'm always tired, so I sleep most of the day away outside of work. Also, my feet are always in terrible pain. With these side effects, I haven't been spending that much time with my family, and when I do, I am always grumpy and frustrated with my inability to eat what I want. It's also very difficult for me to manage with my job. I'm always skipping lunch and fitting in bites at stops, so I never take the necessary amount of insulin.
I am a dietitian. For those of you who don't know what that is, a dietitian is a doctor who specializes in helping people maintain a healthy diet. Most of the people I work with have diseases such as celiac, Crohn's, or diabetes.
Fantastic! And Petunia, could you tell me a little bit about how you've tried to help your father with your career as a podiatrist?
Hello, my mum and dad fight because my dad has type 2 diabetes and my mum just tries to help him stay under control. It's hard for me with my parents and my life at home can be miserable at times. I've always noticed my dad having foot pain, and so I decided to major in podiatry to not only help my dad but others with diabetes.
Oh, okay, that's really sweet of you, Petunia. I'm sure you helped his physical pain tremendously. Now, Emily, could you tell us more specifically about the type of macromolecules people should be using and the quantities?
I recommended to my husband in the past that he needs to eat more protein because it controls his rate of reaction and helps regulate and transport things. I also suggested that he eats unsaturated fats that are lipids that are liquid at room temperature, such as peanut oils and olive oils, rather than saturated fats that are solid at room temperature, such as butter and lard. The unsaturated fats will raise good cholesterol, creating a healthy cardiovascular environment, unlike saturated fats that will raise a good and bad cholesterol. Carbohydrates are important for a good source of energy because carbohydrates turn into glucose. But as a diabetic, too much glucose in the bloodstream can be toxic. I had a patient named Anna Garcia who had type 1, which is still a similar case to my husband's case. I suggested that she take insulin since her body is unable to create insulin because of the type 1 diabetes. But she did not take it regularly and did not stick to a proper diet for a diabetic because she consumed too many simple sugars, more specifically 6 chocolate chip cookies, Coke, and Sprite. She did well at some points, eating eggs for breakfast, which gave long-term stimulating energy over approximately 5 to 7 hours, giving her body time to take in some of the glucose, unlike too many simple sugars, which would provide a quick surge of energy within an hour, overloading the body with too much glucose at once, which is hard to process. In terms of exercise, diabetics should focus on carving out 30 minutes of moderate intensity physical activity. But I'm always telling Mitchell to start with 10 minutes and increase a bit every day. Endurance exercises are great for strengthening one's heart and lungs and improving blood circulation. Examples include cycling and swimming. These exercises will help lower blood sugar concentration. In addition, strength training is an important aspect of a healthy lifestyle and should be performed at least twice a week. Strength training improves insulin sensitivity in type 2 diabetics. When you do strength training exercises that target muscles, your body is able to use glucose from your bloodstream to power them, which can help clear out excess sugar from your system, so it is signaling the glucose to enter the cells.
Wow, that's a lot to consider, Emily. I should follow more of those recommendations myself so that I prevent myself from getting diabetes. Now, Petunia, how else does your career help those who are already suffering with diabetes, especially type 2 diabetes?
Well, I'm a podiatrist, and here are some statistics. More than 65,000 lower limbs are amputated annually due to complications from diabetes, specifically type 2. Once there's an amputation, the chance of another one within 5 years can be up to 50%. Including a podiatrist in your diabetes care can reduce the risk of low limb amputations up to nearly 90% and lower the risk of hospitalization by a little over 20%. The diet of a type 2 diabetic impacts their extremities, limbs, and nerves. With a healthy diet, a diabetic can lower their chance of complications and amputations. I have tried to help my father with all of these things, however, he's still in denial and refuses my recommendations and advice.
I understand that your recommendations are nice, but I do not need your help because my diabetes are under control.
Look, Mitchell, why don't at least you try to follow some of your daughter's recommendations?
I will if I'm more swayed.
Okay, well, if these recommendations are put off for too long, Dad, you could lose mobility of your feet. I recommend the following. You to get shoe inserts, you to get specialized shoes to stop irritation in your feet and to get rid of some nerve pain. And I also recommend for you to come in and let me give you an exam every 3 months, like I've said for the past 5 years. Lastly, I suggest pressure point therapy for your feet so you can walk easier with less pain. You know my friend Carl, his wife Jackie can see you right away.
Fine, I will see Jackie if it will finally make you happy and help my mobility.
Wow, that's a fantastic variety of diet and exercise suggestions from you two. For all the viewers at home, I definitely make sure that you follow those tips in order to stay healthy. Now, many people believe diabetes is truly a physical challenge with the maintenance of diet and exercise, although there's a mental challenge as well. That's where my job as a psychologist comes in. As we heard earlier, Mitchell has been suffering with some denial issues that restrict him from following directions from his care team. As a psychologist, I will make sure that Mitchell feels comfortable with the success of his treatment and target his denial in this way. In addition, I will delve deeper into his non-adherence and search for a serious mental illness such as depression and not being able to eat what one wants and needing to put time aside to exercise. All these things put together can be very detrimental to one's regime. Now, thank you for your time, Johnson family. I look forward to perfecting your care plan, Mitchell, and I hope the viewers at home have all learned something today.
Thank you for having us.
Thank
you.
Bye, everyone.
Bye.
I hate my life.